Okay, neck liposuction. Listen, I'm going to talk to you my way to do this. Now, I call it extended neck and jawline sculpting. I know it sounds like I'm being fancy, but I really do it different. I do it better, but I do it different. So listen, a lot of people, a lot of doctors, a lot of dermatologists, a lot of surgeons will just make a little needle poke under the chin and they'll lipo that little submental fat pad. But that doesn't let things redistribute. It doesn't let the skin fall back. You know, we're going to publish an article here about these horizontal necklines. This is probably the best thing I can do for these horizontal necklines. Those are genetic. Those aren't there because you're old or heavy or whatever. Those are genetic, these horizontal like this. And I lipo way back to here, back to the trapezius, SCM. We get into this posterior level 5 of the neck, and it really lets things fall back. If you see the study, what we're going to do is we're going to measure the marks between these two horizontal necklines. You're going to see it widen after I do this because things lift and fall back. So the broad muscle, platysmal muscle, goes from the clavicle kind of up into the facial tissue. So that's the one that makes those bands. And then it goes skin, and then it goes a layer of fat, then it goes to platysmal muscle. So I separate those two layers. We sculpt the fat to varying degrees under there, and then we let it, reset. So wrap around the mandible. You add buccal fat Chicago style, bam, you're right where we want you. That's what lets that jawline get defined. What makes a hot cervical mental angle is when the hyoid bone is just a little bit higher than the chin tip. It helps create almost that negative, that kind of acute angle there. When you start to get that obtuse angle, when you see the fat pad like that up in her jawline, that's when people come to see me. So we're able to take that more obtuse angle and flip it to an acute angle. That's the sharpness. That's the cervical mental angle people are after. So little needle poke there, little needle poke behind each ear. You look kind of goofy for a good 5 days. I like you to wear the head wrap for 4 to 7 days, depending on the amount of fat we get out. And then I have you start a specialized massage protocol. Takes about 3-6 months really to look hot. But after a couple weeks, you should see things starting to suck in on us. I'll often add some sort of energy, whether it be the Face Tight, Morpheus, Thermitite, J-Plasma, we got them all, to different layers, depending on your specific anatomy and needs and what the causes are. But neck liposuction, extended neck and jawline sculpting, when I talk about it, Dr. C here, check, like, circle, subscribe, all those things. Get on us if you like what you're seeing, and give you some tips. I'm happy to help you guys out, give you some more info.